Wizara ya Afya iko katika harakati za kutengeneza mswada unaonuia kuhakikisha ubora wa afya na usalama wa wagonjwa katika hospitali humu nchini. Katibu katika wizara hii, Mary Muthoni, kwa sasa anaongoza shughuli ya kukusanya maoni ya wakazi wa Murang'a, na kwa sasa, mtazamaji, tunaungana na mwanahabari wetu Robert Gakure moja kwa moja kutoka kaunti ya Murang'a. Gakure, kazi kwako, taarifa kwa mtazamaji, tueleze.
Na mbashara kutoka kaunti ya Murang'a, na ni kweli Wizara ya Afya iko katika harakati za kuhakikisha kuwa kuna mswada ambao utaangalia kuhusu ubora wa huduma za afya na vile usalama wa wagonjwa, na Wizara ya Afya inaendeleza kuchukua shughuli za kuchukua maoni katika sehemu mbalimbali za Wakenya kuhusu mswada huu. Na bila kuzungumza mengi, ningependa kumshirikisha katibu katika Wizara ya Afya, Mary Muthoni, ili aweze kutuarifu kuhusu hafla ya leo, na pengine mswada huu una lengo lipi haswa kwa Wakenya.
Kiswahili ama Kizungu? Na tuko Murang'a, naweza ongea hata Kikuyu. Asante sana. Tuko hapa Murang'a, and we are in the process of having public participation for the quality of healthcare bill and patient safety. The Ministry of Health has already come up with follows initially. That is the Social Health Insurance Financing Act of 2023. We have the Digital Health Act of 2023. We have the Primary Healthcare Act of 2023, and we have Facility Improvement Financing Act of 2023. And when we look at all these acts, they are talking about infrastructure, ring fencing, financing, and commodities. But we have really not gone deeper to protect the patient. That is why we have come up with the quality of healthcare bill, quality of healthcare and patient safety bill. And one of the things that we are going to do with this bill is to ensure that we have an agency that oversights all issues to do with patient care, patient quality. We want clean facilities. We want the patients to be treated with dignity. And every patient will have a right to safe care and privacy, informed consent, and complaints for redress. It breaks my heart when sometimes I see patients, and especially pregnant mothers, rolling on the floor and nobody is really looking up to them. We want somewhere that patient can be able to have a redress of the issues that they have taken place in that health facility. And because we are also the regulator, we will be able to go to those facilities and check what is the quality of care that is being given in those facilities. The second thing that we also want to do is to ensure that there's enforcement of national standards. Many a times, because of the devolved systems of government, we find that maybe facilities at the county level and others owned by the national government. We have facilities that are owned by private individuals. Others are even owned by faith-based institutions. But we find the standards are haphazard and they are not to the norm. Therefore, we want all the health facilities, whether it is public, faith-based, or private, they must meet the same minimum standards of quality. The other one is to ensure that we introduce the ratings, because if you do well, you must pat somebody on the back and tell them, hey, you have done well. So we will introduce rating of these facilities, the ones who have high standards and the ones who are also struggling, so that they can know what are the gaps that they need to put into and improve of the same.